Lung cancer is the #1 cause of cancer-related death of both men and women in the United States, with someone being diagnosed every 2 minutes. Only around 18% of all those eligible were screened in 2022, according to the American Lung Association. During Lung Cancer Awareness Month, we're talking about the importance of lung cancer screenings. And joining us today is Dr. Timothy Setley, an interventional pulmonologist at St. Luke's Cancer Institute. Thanks for joining us today.
Thanks for having me.
Dr. Setley, I want to start with the guidelines for someone to get screened. Can you tell us what those are?
Sure. So we want to screen people for lung cancer who are at high risk of developing that disease. So that means people who are current or former cigarette smokers. And if they're a former cigarette smoker, they have to quit within the last 15 years. We also want to make sure that they have a sufficient smoking history. So people who have smoked at least 20 pack years. That means smoking 2 packs of cigarettes daily for 10 years or 1 pack of cigarettes daily for 20 years or the equivalent. For those people, we will do an annual low-dose lung cancer screening CT scan.
I appreciate you sharing all of that, and also the statistic that we started with, only around 18% of those eligible undergoing screening, is pretty staggering. Why is screening such an important part of all this?
So lung cancer is the leading cause of cancer death both worldwide and here in the US. More people die of lung cancer than breast cancer, prostate cancer, and colon cancer combined. So if we're able to catch a lung cancer early by screening, that patient has a much better chance to be able to be cured of that disease.
And talking about timeline, when should screening take place for a patient regardless of their individual journey?
So we want to screen people who are asymptomatic from lung cancer. We don't want to have people who are having symptoms. So that means they're not having symptoms of cough, coughing up blood, pain in their chest, shortness of breath, weight loss, things that may explain lung cancer. For those people who are asymptomatic, we recommend an annual lung cancer screening CT scan starting at the age of 50.
I know we've talked about smoking being a major risk factor, but what are some other risk factors for lung cancer in addition to that smoking?
Sure. Well, by far and away, smoking tobacco is the biggest risk factor for lung cancer. Other risk factors include some exposures that people would have from their environment, such as radon gas, sometimes asbestos, or a family history of lung cancer in a first-degree relative.
After a patient is screened, Dr. Setley, what are some of those next steps that happen after that?
Sure. So a patient will get a report in the mail, and if the report comes back and doesn't find any abnormalities, then nothing has to be done. They would be scheduled for a follow-up CT scan in 1 year. If abnormalities are found, then generally that patient would meet with their physician, and we would have a discussion with them about the next steps, which could include more radiology scans or sometimes a biopsy to try to figure out what's going on.
So a patient receives that lung cancer diagnosis. What are some of the treatment options that are available to them?
So it really depends on what kind of lung cancer it is and how advanced it is. If we find a lung cancer early, oftentimes we can do surgery to take it out and cure the person of that disease. If surgery is not an option, then oftentimes radiation therapy will be. For more advanced cancers, we'll often use a combination of things that could include drug therapy like chemotherapy or immunotherapy, sometimes radiation therapy, and sometimes surgery as well.
Lung Cancer Awareness Month, obviously this is such an important topic, and I want to end on a hopeful note. Dr. Setley, what sets St. Luke's apart when it comes to our lung cancer care and the team that we have?
I think it's the people we have here at St. Luke's as part of our team and the technology that we have access to. So we have a dedicated team of medical professionals, both doctors, nurses, and ancillary staff, who all work together every day to treat people with lung cancer. And we have access to some of the best equipment available, the most advanced, minimally invasive techniques for diagnosis and staging of lung cancer. Our surgeons have access to minimally invasive robotic surgery to remove lung cancers from people. Our oncologists have access to all of the latest drug therapies, immunotherapy, chemotherapy, targeted therapies, clinical trials. We have excellent radiation doctors here. All of us work together as part of a team with the best technology to treat our patients.
And you are an important part of that team, Dr. Setley. Thank you for all the great work that you do, and thank you for joining us. We really appreciate it.
Thank you very much.
To learn more about St. Luke's Cancer Institute's multidisciplinary thoracic clinic, visit stlukeskc.org/thoracic. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks for watching. We'll see you next time on Health News You Can Use.